This is a case study about when scanning is helpful, and when it is less clear. After an acute injury, the person in pain visited A and E and had an X-ray, showing no fractures. Yet, 2 weeks later when visiting my clinic, the pain was persistent, and consistent with a possible fracture. Fractures can be overlooked in emergency settings due to a number of challenges. This is not in any way a criticism, it is a fact and is due to a number of factors, including quick life-saving decisions being made, the severity and complexity of the injuries presenting, and the often unrealistic multiple concurrent tasks and the multidisciplinary approach expected. Given the patient's elite competition level and upcoming world championships, we debated the need for additional scanning. Stress fractures are considered clinical diagnosis, which means that scanning is not essential, but the patient felt that psychological clarity would help them. Unfortunately, the second X-ray yielded the same negative result but indicated a shadow of a potential historical and healed fracture. Scans can lead to 3 outcomes. First, scans may show no issues, which is the best result, but can be extremely frustrating for those in pain. Second, they confirm a working diagnosis. But this of course does not fix the issue or change the healing response. Lastly, they might identify serious complications needing urgent treatment. Pain doesn't always correlate with visible damage. And scans simply offer a snapshot of a moment in time. The next day, a fracture confirmation emerged via phone consultation, but this was again later dismissed by a 4th radiologist's report. So how should we approach treatment? We proceed as if it's a fracture, as it presents in the clinical environment, and we follow best practices. This all underscores the complexities in injury diagnosis. While scans provide insights, they don't always yield the clear answers we so desperately want. And sometimes, they can eat into recovery time through waiting for a black and white answer that may not exist. If a therapist hesitates to facilitate a scan, it may reflect these complications, or concerns. If you are in persistent pain, feel free to visit dcinjuryclinic.co.uk and drop me a message.